Good afternoon. How is everyone? Can you guys come on over this way? Come on over this way. I won't bite and I won't tax you. My name is Teresa Oakey, and I'm the State Director for Americans for Prosperity. And I want to thank you for joining us here today. We have done I'm going to need that piece of paper, over 60 stops in the state of Arkansas after today, I guess I should say after Saturday, on our Hands Off Our Healthcare bus tour. So I want to thank you so much for coming, because if we pull up to the curb and nobody's here, we cannot make a difference. And we are here today because last 2 Saturdays ago, the House passed a 1,900-page bill laden with new taxes and mandates on small businesses. With 10% unemployment in the nation, which is likely to rise, Congressman Vic Snyder and Marion Barry voted to pass Nancy Pelosi's, that's right. Studies show that small businesses have led our economy out of 7 of the last recessions. Yet we are choosing to go down a path in raising billions of dollars in taxes and new mandates that fall disproportionately on small businesses. This is absolutely the wrong prescription for the economy. But not to be left out, last night Senator Harry Reid introduced a 2,074-page bill that has over 370,000 words, 183 references to taxes. The CBO estimates that it will cost $843 billion in spending, which we all know is shady accounting, as we collect taxes for 4 years before we spend any money. It also has $436 billion in cuts and still leaves 24 million people uninsured. They say the only place in our country that they don't see the recession is in Washington, D.C., and I absolutely believe that. Because that's the only place heralding these bills as moving in the right direction to accomplish health care reforms is in Washington, D.C. I happen to believe it's because they don't live in the real world. They live in a world where if they want to spend money, it magically appears or they print it. That's right, it is our money. And it's the only place where you can pass a health care reform bill that you are exempted from, but if we don't participate, we go to jail. My friends, these bills, the chances for them to actually accomplish health care reform is about as realistic as the 48 jobs created in non-existent congressional districts here in the state of Arkansas that cost us $24 million to create. But we're not just here to talk about what doesn't work. Americans for Prosperity and everybody here agrees that we need health care reform. But what we know, these bills will do nothing to contain health care costs, and they will only lead to delay and denial of care for us.
Good afternoon, everybody. It's a pleasure to be here. Yes, it is true. I am a Canadian citizen, and I am very proud to say that I am working towards my American citizenship right here in the United States of America. This whole topic of health care sounds awfully familiar as a Canadian, awfully familiar. And as a Canadian, I often get asked, so what was it like to live in a country that had free health care? Well, folks, I got a bit of a reality check for you. Canadians pay dearly for their health care, dearly. Taxes are so disproportionate, and the numbers I'm going to tell you today are mind-boggling. Your first $38,000 in the province of Quebec is taxed at a rate of 28.5%. Your first 38. Combined household income of $126,000 or more, you are taxed at a rate of 48.2%, folks. 48.2%, and that does not include the 13% sales tax. So what does that mean to me by moving to the United States? For me, that meant a $313 pay increase every 2 weeks. $313 in my wallet every 2 weeks, extra. And you go, well, didn't you have to pay for health insurance here in the United States? Yes, I did. But I also paid for a supplemental insurance plan in Canada, and that covered dental, vision, and stuff like co-pays, hospital upgrades, and different tests. That was offset by the plan that I bought here in the U.S. Every year, that meant $8,000 extra in my pocket. $8,000 by moving to the United States of America. $8,000 and a whole lot more choice. As a small business owner, my wife and I own a restaurant in Memphis, Tennessee, right downtown, and we employ 55 people. The repercussions of what is coming across in this healthcare bill is very nerve-wracking, petrified, to say the least. Conway, my word! All right. Stimulus dollars, hard at work, Dick Morris says. All right, so as a small business owner, this potential 8% payroll tax to cover health care for our employees, if we don't pay for employees for 55 people, it's an 8% payroll tax. That represents $40,000 a year off the bottom line for our business. And if you know the restaurant business, margins are already razor thin. So where does it come from? It either cut staff, cut benefits, raise prices, or possibly all three. Or risk closing doors, and I'm not closing my doors. So it's got to come from somewhere. Folks, I can't tell you enough how important your voice is. As a Canadian, I have no vote in this stake yet. But I can't impress upon you enough. Your vote and your voice means absolutely everything. Folks, be heard now, and be loud and be proud to be American.